I'm very pleased to welcome you at the Institut Pasteur for this conference organized by the Bill and Melinda Gates Foundation. The Institut Pasteur is one of the major partners for the control of neglected tropical disease. And actually, we are collaborating with many of the institutions which are represented today. And also, Institut Pasteur has been one of the founders of the DNDi. The Institut Pasteur has a unique stand regarding research on microbiology and infectious disease, and in particular on neglected tropical disease. And this unique positioning comes from the combination of several expertise the Institute offers. It creates knowledge through basic and interdisciplinary research, and it is also a partner for public health and medicine, both on national and international level. Our institute plays a very important role in the surveillance and monitoring of outbreaks and epidemics, and its capacity to rapidly react to a sanitary crisis has been well demonstrated recently through the outbreak of Ebola hemorrhagic fever in Guinea. The Institut Pasteur is in fact an international institute anchored in France. This institute in Paris, where we are, is at the core of an international network of 32 institutes in 25 countries. This network is based on on-site capacities, long-term relationships with local governments and public health institutions, thus generating research questions which arise straight from the field, from those countries dealing with a public health problem. This problem-solving approach offers the possibility to translate innovating research concepts and technologies into a global health strategy. It also offers the capacity to perform clinical research and to evaluate vaccine efficacy. And finally, and this will be an increasingly important challenge, the Institut Pasteur and its network can be partners to assess the real impact of global health strategies. So in this context, this is one of the main objectives of my mandate as president of the Institut Pasteur, to reinforce this positioning of the Institute and to work with all the major stakeholders on these crucial challenges. So the Institut Pasteur has always been highly committed to the fight against neglected tropical disease. I trust that this conference will provide extremely interesting information, and on our side, we will very much reinforce in the future our efforts in this field and will enhance our collaborations with all the parties involved. I thank you very much for being here with us. Thank you. And now it is my pleasure to introduce Madame la Ministre des Affaires sociales, Madame Marisol Touraine.
Thank you, Mr. Director. I'm very happy to be here this afternoon with you in this so famous place for research in France. And I have to say I'm very happy to welcome President Gates and Mrs. Chan for the WHO. We are very happy to have the opportunity to have this discussion. And I want to say I am sorry not to be able to stay with you longer because, as you may know, we have some changes in government this afternoon in France, and so I have some little things to fix. Madame la Directrice Générale de l'Organisation,
Madam Director General for the World Health Organization, ladies and gentlemen, distinguished guests, President Bill Gates, ladies and gentlemen from NGOs, the meeting that is organized this afternoon at the initiative of the Gates Foundation is rooted in a very stark realization, and none of us here can be resigned to this, which is that during the year 2000, in the space of barely 10 years, less than 4% of new drugs targeted neglected diseases, whereas those diseases represent on a global scale over 10% of diseases. See, these diseases are indeed neglected when they threaten over 1 billion individuals worldwide. And day after day, they are causing 35,000 deaths in Africa, Southeast Asia, and Latin America. Neglected, the word is, of course, far from neutral. It means that today no efficacious, simple, adapted treatment is currently available for all these diseases. Neglected these diseases are, and they are not unknown. They are not unknown because they bear a name, and these names are quite well identified, included by our fellow citizens: sleeping sickness, the Chagas disease, Leishmaniasis, and of course these diseases principally affect poor people on our planet, those who in particular don't have access to medicines, people who all too often are neglected, and that is unacceptable to us. These diseases are not totally unknown to the wider public, and they're not unknown to international policymakers and NGOs who've begun to sound the rallying call. And this rallying call must be extended, and that is why I'm delighted that at the initiative of the Gates Foundation, this meeting is being held. WHO, and I'd like once again to acknowledge the presence here of Dr. Chan. WHO really was the pioneer, the spearhead in this fight. In May 2013, WHO took two major decisions. The first was to set up an observatory for research and developments in health to better identify needs and requirements and also to set priorities. France supported this effort and this resolve by contributing to the work that allowed us to reach this decision by supporting this goal and contributing its expertise. The second milestone decision taken last year in May 2013 is the launch of what's known as demonstration projects aimed at the emergence of innovative solutions to encourage research on these diseases. The mobilization of the international community was, of course, crucial, but to go beyond this mobilization is not enough if, inasmuch it only concerns public players. There was a vital need to work in close conjunction with industry and, of course, the pharma industry, and I wish to acknowledge the role played in the ties that have been forged. The Gates Foundation that pushed strongly businesses to sign up. In May 2012, through the London Declaration, a momentum bringing together 13 drug companies, donors, as well as foundations, was launched. And the goal was set to control and then eliminate 10 tropical diseases. The panelists that you have convened, Mr. President, will no doubt say in a moment that many neglected tropical diseases can be treated with drugs, and research work continues to demonstrate their efficacy and safety when they're administered alone or in combination. And of course, the donation of drugs have made it possible to overcome some financial obstacles. There are some encouraging results, notably for sleeping sickness. And for this disease, we need to step up our efforts. France has signed up to this fight because the values of our country that are upheld internationally and the expertise of our researchers and scientists, as witnessed by the Institut Pasteur, where we are, and the role that we played in setting up the Global Fund and Unitaid, give France a strong legitimacy to promote access to healthcare products. For many years now, France has played a key role in the fight against neglected tropical diseases through initiatives led by the Institut Pasteur and the full network of Pasteur institutes worldwide, as well as the Research Institute for Development. Lastly, I mentioned the need to mobilize support. I cannot mention that term without referring to civil society, that is to say, all the NGOs, associations of doctors such as Médecins Sans Frontières, and in many other sectors too, and I'd like to refer to the original approach of DNDI, the Drugs for Neglected Diseases Initiative, which is highly original and whose efficacy has been amply demonstrated by removing barriers that sometimes exist between the public and private sector. It's possible to bring about the convergence of strategies that complement one another. If we are to continue the fight against neglected tropical diseases, we must step up our efforts and go the extra mile, because there's a major lag between the health need of developing countries and efforts that are currently accomplished in terms of R&D to respond to that. 90% of R&D expenditure in health covers only 10% and meet only 10% of the needs for treating diseases, and that needs to be remedied. To go further, our effort needs to be expanded in two directions. First of all, we must step up and reinforce the health systems in each country. Without sustainable funding, without qualified healthcare personnel, without the necessary infrastructure, our efforts will not yield results. That's why France has promoted the Universal Health Coverage Initiative, which is a key component for healthcare going forward. Let me add that over and above universal health cover, there's a matter of supporting countries, as is done by France, to support countries in implementing healthcare systems and social protection systems that are consistent. Very often we have healthcare systems that cover certain countries and social protection schemes that also exist without there being a good fit between them. This leveraging of cooperation that can exist with developing countries is the condition for lasting progress. I'm convinced, France is deeply convinced, even if we must not make contingent the development of health policy initiatives to the implementation of universal health care coverage policies or more robust healthcare policies. At the same time as we roll out these cooperation and support policies, make sure that the countries concerned really do contribute to this effort and providing the necessary support to their population. Second focus is that of research, and it's by concentrating our efforts in this direction that we will be able to discover the drugs to meet the needs of the population. I'd like to acknowledge the announcement of the French Development Agency that plans to set up a new financing facility to support WHO in the field of neglected diseases. This new contribution of 2 million euros will be added to 5 million euros recently granted by the French Development Agency to DNDi in order to fight against malaria, sleeping sickness, and leishmaniasis. Secondly, I'd like us to be able to trial new PPI, public-private partnership models in France with the Bill Gates Foundation. I've suggested that we should conduct in cooperation a hospital program of clinical research in favor of a neglected disease for which work remains to be conducted, visceral leishmaniasis. This disease is present in 3 countries and over 3 continents, over 100 countries, leading to the deaths of 50,000 people every year, and one of the most neglected diseases after malaria, and it's therefore one of the need to develop a program to develop new medicines. Hopes are possible. The DNDi has authorized a candidate for which preclinical trials are positive to be able to initiate a phase 1 clinical trial as of 2015, which will take place within the French hospital investigation structures, and I propose that it should give rise to co-funding by the French public authorities and by the Bill and Melinda Gates Foundation. Ladies and gentlemen, members of the healthcare communities and members of the international community, new solutions must be devised and implemented between public policy makers and private players in these countries so that we can move forward and ensure progress both in research, healthcare systems, and of course the management and assisting the people on this planet who are facing the greatest difficulty to treat diseases which, however remote, are nevertheless very real. That's how we will be able to promote and bring about access to healthcare for a greater number of people on this earth. It's one of the ambitions of my policy, one of the ambitions of France, and that's why I would like us to collectively move forward. Thank you.
Bonsoir and hello everyone. It's a big privilege for me to first introduce the panelists and our very exciting discussion. As Minister Marisol Touraine said, it is a very important topic, and the leadership of the different peoples around this table is really impressive, and that I think something we can share with her remarks. I would just like to introduce briefly our speakers. First, Dr. Margaret Chan, Director General of WHO. Jamie Cooper-Hahn, Chair, Children Investment Fund Foundation. Bill Gates, Co-Chair, Bill and Melinda Gates Foundation. Dr. Tim Evans, Director for Health, Nutrition and Population at World Bank. Dr. Onesim Ndayishimiye from Burundi, a neglected tropical disease control program national director and Ministry of Health. And Christopher Havirbache, CEO, Sanofi. So, very complete panel with industry thinking, philanthropy, and specialists, and of course these international bodies like World Bank and World Health. So we have, I think, everything here to conduct a very interesting discussion, and particularly because we are in 2014, 2 years after the London Declaration. And I know you have been working this morning hardly, and in this very impressive endeavor, which really connect private sector, NGOs, government for a common topic, a common cause. This London Declaration was very important. Again, health, in the domain of health, you are really inventing a new mode of governance, which I think, as a former diplomat and in charge of global public goods, I must say health every time, and your particular endeavor, for me, was always guidelines, producing guidelines. It's really innovation, what we are talking about. So first, I would like you to ask you, and first Margaret, and for each of you a very short comment on where you are here, why this topic of neglected tropical disease are so important for you. And Margaret, first, you could tell us.
Thank you, Laurence. Good afternoon to all of you. Why do I come here? Number one, I love Paris. But jokes aside, I come here to thank all of you. To thank all of you, the endemic countries, the civil society, the industry, the development partners, Bill, your good self, and other friends and colleagues who are in this room and also not in this room. Thanks for your commitment to address neglected tropical diseases. It is no longer neglected because you are shining a light on a group of diseases that shackle more than 1 billion people of the world, and most of them are women and children. If indeed we want to be successful to achieve MDGs, NTD must be a priority. And on that, I come here not only to champion and advocate for the voiceless, the faceless, and the powerless, the bottom 1 billion people. But as I said, I come here to thank you, but also to celebrate the success and the progress we have made since 2012. So perhaps I'll stop there.
Thank you. Thank you, Margaret, and thank you to help me in conducting swiftly the discussion. Bill, when a global leader meets a global cause, what happens? And why are you here, and why this topic of neglected tropical diseases is dear to your hearts?
Well, if we look at the overall disease burden for these 10 diseases taken together, it's right up there with any of the worst diseases in the world. It's right up there with malaria or tuberculosis. And yet, because there are 10 of them, they're slightly different places, slightly different ways we deal with them, there's a level of complexity that meant that they just haven't gotten that much attention. And everybody was looking at this problem from their own point of view. And I do think the declaration that was made 2 years ago was a breakthrough, and that the rate of progress we've seen and that we will see between now and 2020 is dramatically different than what came before. Part of that, one of the big threads that pulled together that declaration was a group of the CEOs of the pharmaceutical companies who sit down on about a yearly basis with the Gates Foundation and talk through what's going on with the needs of the poorest in medicine, how can their expertise be applied either with drugs they already have or drugs that they could help discover to help those most in need. And through those discussions, the idea that perhaps the drug donation piece for the drugs that exist, we could get commitments there that would kind of take that away as a limiting factor. That could be done. And what was amazing was once we did that, then it shined the light on that we needed money for delivery to actually run the campaigns in the countries. And so we thought about optimizing that, and that led to the opportunity of integrating the delivery. So we would do maps and see, okay, where did these diseases overlap? And so the efficiency is dramatically higher. And in fact, the value per investment here is as high as any of the other great things that are being done in global health. Having done that, then it really shone a light on where we still need diagnostics and we still need drugs. And so it created an agenda that the pharmaceutical companies are diving in to help out with, an agenda of the missing pieces. And so we have renewed energy on R&D along with all the drug donations.
Thank you, Bill. And I think we see the list of these CEOs that pioneer this enterprise. And of course, that's fascinating to see all these forces join together. Onesime, you are representing Africa in this panel, so it's a big responsibility. And what's the importance in view from your continent?
Thank you, Ms. Chair. First of all, let me express my greetings to everybody. Hello, everybody. So it is a pleasure for me to be, and an honor for me to be a member of this panel with great personalities and persons of this world. So I begin to thank, before answering to your question, I begin to thank the organizer of this meeting, the Bill and Melinda Gates Foundation, who supports my participation here, and also to thank Burundi partners on neglected tropical diseases, because we did and we continue to do a good work. I thank especially the Gatton Foundation, CBM, Schistosoma Control Initiative, World Health Organization, MECTISA Program Donation, and also African Program for Onchocerciasis Control. So, returning to the question, it is important that the neglected tropical disease receive attention because it is recognized over the way that reducing the burden of this disease is a critical component for achieving a range of global development objectives. And for my country, lifting the burden of this disease will make my country and the other endemic countries flourish. It is the reason why it is important that this disease receive their attention. Thank you.
Thank you very much, Onesime. Tim, for an organization like World Bank that really has focused on development, your attention to this problem is really, like Onesime said, it's a matter of development. These diseases are having heavy burden on people, on development of economic growth. Why is that really the major concern for World Bank? And finally, do you identify health issues, and in particular this one with a proper development strategy?
Yeah. Well, thank you very much. And you're absolutely right. These neglected tropical diseases are major constraints on development, on the development of children and their opportunities for education, as well as the ability for adults to engage in productive work. And therefore, addressing them is not simply providing the opportunity for an entitlement to health, but also to really eliminate extreme poverty and boost shared prosperity. But I'd like to say, just in terms of why we're here, and many people may not recognize this, but we're here primarily because of two French scientists. In early 1970s, an epidemiologist by the name of René Lebert, and also a parasitologist by the name of Bernard Philippon, convinced the World Bank president at the time, Robert McNamara, to visit Upper Volta, or what is now Burkina Faso, and go to a village, a hyper-endemic village for onchocerciasis, river blindness, and see what it looked like. And it was Robert McNamara and his wife who saw the impact of those diseases, that disease, in terms of the very, very high levels of blindness in the adult productive population, and also the impact on the evacuation or the non-use of fertile river valleys, which led the World Bank to make its first investment in health. And I think had that visit not taken place, had those researchers not had the wherewithal to get the World Bank president to come and see the extent to which onchocerciasis was such a fundamental constraint to development in West Africa, then I might not be on this panel today. The bank may never have entered health. So I have René Lebert, Bernard Philippon to thank for my presence here today. But really, I think it should be recognized that those researchers were the seed for getting the World Bank involved in health.
Thank you, Tim, and I suppose that's not difficult to bring Kim along these lines now. It will be your work is even easier now, so that's very good. Chris, and as Bill said, it's about strategy, it's about organizing efforts. What's your views of how industry can help and why it begins to be an important issue for you as well? I am impressed by the scale, the number, the timelines. It's really a business to do that in a very good sense.
Yeah, I think, the first thing is let's never forget that companies are made of people. And we as people, whether it's at head office or we shouldn't forget that in all of these countries we have people who are working for our companies. And so we're all very aware of the human need to actually make something happen. Just in the way that the former president of the World Bank has been out there and actually seeing what's happened. I know I've certainly been out there. I'm looking at Stefan Oshman or Paul Stoffels or Sir Andrew Whitty. They've also been out, I know personally, and seen this firsthand. And you can't come away from seeing children, families who are affected by these diseases. The difference, of course, with us is that, well, we can't really say, well, that's somebody else's problem. We actually have the means to make a difference. We have not only the medicines, but I think some of that organizational ability. Now, prior to the London Declaration, many of us had programs before, but we were doing it individually. And, when Bill brought us together, it was really in the very same way that the Bill and Melinda Gates Foundation has brought metrics and really managing performance of resources. He said, if you guys all work together, we could actually solve an awful lot of the problems, supply issues, and actually go beyond the supply issues. And so when you look at it, we were treating approximately 900 million people in our individual programs. And since 2011, we have boosted that by 35%. And that's 300 million more people who are being treated. We've actually come together and looked at how do we then solve some of the other, what seem like banal issues, but quite honestly, when you've been there, distribution is a massive problem. Dealing with customs, dealing with regulatory affairs, dealing with who's going to train the healthcare professionals. So I think as industry, we have benefited. We are normally competitors. We don't necessarily want to particularly work with giving each other credit, but I have to say I'm particularly proud of our industry in the way that every CEO has come. This isn't something that we have delegated. When we get together, there's no staff. It is CEO only, and every CEO is expected personally to take commitment for their company and what they're doing. 2013 was the very first year, Margaret, I think, where there have been absolutely no supply interruptions on all of these medicines, largely because we actually, as CEOs, then got our organizations much more aligned with what we were trying to do collectively. So, it's just been a fantastic experience, I think, for all of us.
And of course, cooperation is really very innovative in your sector. By the way, I was thinking, listening to you, Bill, would you do that for climate change as well? Would you gather a number of people and say, let's do that? Think maybe for next year.
As soon as there's a pill for climate change, these guys will be glad to make it.
So maybe we can think about that. Jamie, I have had the privilege to interact with your foundation. It's a very interesting philanthropy. Organization is innovative in very different domains, policy, project. So what's your focus on this?
Thank you for the compliment. Everybody on this panel and many, many of you in the audience work for NTDs. that focus much broader than NTDs. And for many of us, mortality has been a huge, huge priority. As the Children's Investment Fund Foundation, it certainly is not enough for us to have a child survive but not thrive. And worms are one of the most disastrous impediments to children being able to thrive on many, many fronts. Almost half of children globally are in areas of high infestation, and it affects their nutritional outcome. It contributes to stunting. The work that we've done in this area was built largely on a study in Kenya, which showed a 25% reduction in absenteeism in school once children were dewormed. It's a huge health issue. Children can't be strong enough to fight other diseases. So this is a great investment, and because of the partners coming together, it's a really highly leveraged, exciting place to be.
Thank you very much, Jamie. Well, now I will maybe concentrate or try to deep a little the discussion and ask Margaret to just assess the balance after 2 years, where we are. And again, from the point of view of one of the leading UN agencies, WHO is certainly one of the more effective ones. So evaluation of action is certainly one of the center pieces of your activity. So what do you think where we are after 2 years?
Thank you, Laurence. 2 years ago was not too far away. I can still remember our meeting in London. Let me appreciate Bill for bringing all of us together. You're right. We've been doing this separately. But, you know, when you bring people together, the synergy is much bigger. Now, when I look at what has happened in the last 2 years, I don't know whether the CEO in the front row here remember what I said to you. I did say to you, what gets measured gets done. Before you make any pledges, make sure you deliver, because I'm going to monitor you. And I have to tell you, I did that, and I personally met many CEOs, and I still remember I picked up the phone and talked to Andrew Whitty. I said, Andrew, I need more medicine for the worms of the world who are living in the tummy of the children. Can you give me a promise to donate as much as we need until we finish the job? Andrew says, Margaret, I cannot give you an answer today. But he came back very quickly. He said, we will do it. Now, that is just one example. I talked to many of them, and I have to tell you, we've been tracking them. All companies, pharma companies that make pledges, deliver on their promises. Number one. Number two, and I also want to thank US in particular, UK, the foundation led by Gates. You also have kept your promises. And what is exciting now, you're bringing new partners. Now the bank is here, and the Children's Foundation is here. So those are some of the good progress. What about WHO? Now WHO, since the 2012 meeting, we take it to heart. So we have presented to the World Health Assembly, where 194 countries congregate and make major policy decisions. A resolution was passed, and the countries of the world committed to scale up to deliver on the policy and the roadmap for control, elimination, and eradication of the NTD diseases. So we are making good progress. 70 endemic countries already have a good national plan. We are on the brink of finishing Guinea worm. We are very close. And of course, thanks to the donations, we have no interruption in drug supply. Now it is how can we work together to build the system capacity in logistics, in human resources, to have integrated approach to deliver a package of services. It's not just for NTD. NTD diseases can be packaged with, vaccination and other programs. So these are things that we are very excited about. Let me give you one example. Chris, you visited CAR, Central African Republic, and saw the devastation and the suffering of people affected by sleeping sickness. And Chris just promised me, Margaret, we are going to pledge more See? So those are just some examples of achievements. And now the World Bank is on board.
Margaret, do you want new commitment today now?
No, my commitment is make sure that, of course, my team is here.
No.
They will redouble their effort and push every partner and monitor everyone, including WHO.
Yeah.
Let me finish on World Bank. 115 million, that's a lot of money. Can you channel some of that money where the gaps are? We have all the medicines, thanks to all the 10, 15 companies who have been committed to that. I seldom praise farmers like this. So don't get jealous, all of you. I mean, this is an area I want to emphasize. Bill, you bring us together in 2012, and we see the scaling up. But these companies have been a long-term partner for WHO, and their donation programs go back to 10 years, 20 years. So this is an area where innovative partnership can make a big difference in a group of diseases that shackle more than 1 billion people in poverty, especially women and children. So I think, Laurence, to answer your question, it's a success story, but we must keep the momentum.
So don't be complacent. We have to follow up. Thank you, Margaret. Onésime, what's your, now again 2 years after London Declaration and in charge of the program, how you see condition improving, what are the difficulties, how you see you are really implementing the program on the ground, and of course seeing all the systemic aspects that Margaret was referring to. So what's your assessment, or what you need, what do you need more, and what are the difficulties and possibilities of implementing that on the ground? J'aurais pu vous parler en français.
Thank you. I think like our African country, we are very proud for our NTD programs, for our success, of course, even if they are small. But indeed, if I give the Burundi example, we have built a cost-effective NTD program by integrating the screening, the treatment, the evaluation of multiple diseases, necrotropical diseases. Perhaps if you see our data, you can see there is improvement. There is another slide for onchocerciasis, but perhaps it's not available.
That's impressive.
Also, like experience, Burundi NTD control program was implemented by funds provided by private philanthropic from Ligatum Foundation, the Ant Fund, African Program on Onchocerciasis Control, Christopher Blinden Mission, Schistosoma Control Initiative, of course, Burundi government, and from drug donation, from MEG-TISA program donation, International Trachoma Initiative, and Food for the Hungry. So with those supports, for example, during 4 years, we treat 31.5 million. We give 31 million treatments. It doesn't correspond to this, right? Yeah. This right is finished now. I'm saying other accomplishments. We treat also 5 million people against schistosomiasis, onchocerciasis, trachoma, and soil-transmitted ailment. We develop also, we produce tools for information education, for behavioral change. We trained health staff and laboratory staff. And also we survey individual for STH, schistosomiasis, and trachoma also. Also, we must note that our success demonstrates how cost-effective our NTDs program is. Our NTD program is. For example, during our MDR campaigns, done twice per year, we treat about 4 million people by using $3 million, so less than $1 per person treated, drugs included. But another question, before London Declaration, of course, we had the strategy, the control strategy only. But after London Declaration, we moved forward, and now we are adopt the strategy of elimination. So we hope with the support of our partners, current and new one, because we need also new donors, we can eliminate onchocerciasis, schistosomiasis, and trachoma. I take this opportunity to thank the EPOC African Control Program for its support for elimination of onchocerciasis, the schistosoma Consortium for Research with SCI for their new commitment to eliminate schistosomiasis, and for the End Fund with CBM for eliminating trachoma. Thank you.
Thank you. Thank you. I have to borrow from one of you a watch because I don't have, so I have to keep control on this discussion. And thank you because you have been very synthetic. I don't have my lens, so that's so I'm just half blind, and so that's it. It's big numbers. That's good. Bill, every time I listen to you, you are talking about plan, strategy, numbers. So what's next? What's the next plan now we have advanced since London?
Well, we have to up the delivery intensity, but also there's, thanks, not that loud. There's lots of room for innovation, and innovation in this field goes back a long time. I remember when I met Bill Fahey, he was talking about the early days where Merck had proved out that ivermectin worked in such a phenomenal way. But I think we'll see even more of those innovations, and I'd like to cite two areas. For sleeping sickness, I think I have a slide to illustrate this. It's been very difficult to diagnose and treat the disease. In fact, there's a film on the web that Al Jazeera did that shows MSF going into a village in DRC, and they're taking in the centrifuge and a team of people, and they do lumbar punctures right there in the village. And if you're diagnosed, they have to take you, and you have a very complex treatment for a period of days. So you can't stay in your village. We have three innovations here. One is the sand traps to kill the sandflies that transmit this. Didn't work in these river areas, but now they've downsized them and come up with a design that works very well. Second is now they have a diagnostic. This actually comes from a lyre. It's a lateral flow where you just do a finger prick. And so that piece is greatly simplified. And in the next few years, there's a drug that Sanofi is working with that's in, I think, phase 2 at this point that's looking very promising, the hexanidazole, that would be an oral cure. And so we eliminate the need to leave the village and do something complicated. And so if you get out into the 2017 period and look at the number of people and the complexity of what it means to go run a sleeping sickness campaign, it's greatly simplified. And that's meant that this disease, this is one of the diseases where the goal was control. Now, because of these new tools, just a few weeks ago, they switched to have this be one of the ones where they want to go for elimination. So that's innovation. One other innovation I'll show quickly. This is something people have talked about. Could you use cell phones to do diagnosis? And people have been playing around with it. But in fact, one of the problems in the neglected diseases is this condition called loa loa is in a big part of Africa, and it prevents you from using several of the drugs. And what this is, it's a cell phone. You just stick this cell phone in to this plastic magnifier. You use the camera on the cell phone. It runs a little application that looks at the image of the blood that you put in here, And immediately you get a readout, does the person have low, and you know to treat them in a different way. Before, it took a long time, and so the person would come in, and then you'd have to have them come back in. And so you really couldn't do mass drug administration in those areas. So in those areas, Aleph and Onco were rampant because our normal approach didn't work. Now that we have this, although it's a little bit trickier than just handing them the pills, it can be done in the mass drug form. So, we've got need for innovation, but we're moving faster than ever before.
And what would be the cost of this?
Oh, this thing would cost maybe $20. I mean, that is very cheap, plus the cell phone.
Yeah. But everybody has a cell phone, so thank you so much, Bill, and thank you to really have been. Chris, again, it's, of course, where is the industry now on this? So you have been grouping forces, trying to have a common strategy. What's the future? More research? What the value you see forward to do that?
Well, I mean, the first level of engagement is clearly the drug donations. If you look at the 10 years that will cover the London Declaration, the amount of the donations estimated to be some $19 billion. What's also interesting, for every dollar that's invested in actually providing access and infrastructure, it generates $10 in drug donation. The problem, of course, is that, as you all know, when you go out into the field, patients aren't waiting for the drug in the hospital. You actually have to go out and find them. You have to diagnose them. Bill just talked about sleeping sickness, for example. So you need to think about what can we do to actually get patients to get the treatments. Part of that is diagnosis. So they're not just pharmaceutical companies in this group. We have Becton Dickinson, we have bioMérieux, for instance, who are looking at how do you provide some level of diagnostics, and Bill's talked about one. We have other companies who are involved in this, GSK, Merck, SI, and the Bill and Melinda Gates Foundation. Have committed to subsidizing the test strip to ensure a national program of diagnosis. Then the next thing is, if you got diagnosis, can you get new cures? And here we've been, I think, very successful in working with DNDi. Johnson & Johnson has a new drug that could actually go after 3 diseases, 2 of which are on our goal for elimination, the lymphatic filariasis and the onchocerciasis. This would actually allow us to kill the adult worm, as the current treatments only kill the baby worms. We also have a similar drug in this class for development. And DNDi has been provided from 8 companies with 7,000 compounds for screening. Tuberculosis is a major issue. We have an Accelerate TB initiative where companies are coming together, sharing research in an effort to find new cures. We've been working on the distribution issues and have a partnership going on with DHL, for example, to see if they can help us to solve actually some of the basic distribution issues that often thwart the access to medicines. On vaccines, we've created an initiative. Obviously, we develop vaccines for perfect conditions, many of which don't obviously exist. If you have 50 degrees centigrade heat in Africa, for instance, how long can that vaccine stay out of the cold chain? And so we actually have identified a number of critical vaccines where companies are investing in doing the stability testing to see whether you can leave that vaccine out of the cold chain for an hour, for a day. This can make a huge difference in the actual logistics of key vaccination programs. There are local manufacturing initiatives that are going on. We've been trying to reduce the cost further of medicines. We have also another initiative that's where we're piloting different pricing structures because you're increasingly seeing disparities of income in a lot of markets. And if you could actually have tiered pricing within a market, you could potentially really improve the access because that would actually support the funding for healthcare infrastructure. And then that would also benefit those who can't pay, and really the scarce resources needed for those who can't pay is actually really being dedicated to that population. So, if you like, it started off as drug donations, but it can't stop there. It has to go further, and that's really the commitment that the companies have been making in partnership, though, with WHO, with DNDi, with the Bill and Melinda Gates Foundation, really to bring differing resources and expertise to make sure that whatever we're doing is effective.
Chris, you raised the problem of a sustainable financing system in a way, and how you create a positive, interaction between business and government, and what the World Bank can bring to how you see the problem. Chris was referring to have a chair financier, and we know that we have to create markets at the same time to finance. I think what Margaret and Jamie was saying, we need that this health system together with the drugs. So funding and resilient funding is absolutely strategic. So that's your job normally to do that. So what's your vision of how you organize not only the money but the system, the economic system around that?
Thank you very much. And let me first begin by recognizing how important it is to have the global mobilization with the pharmaceutical companies, not only in the area of the pharmaceutical donations of the drugs, but also what I'm hearing increasingly is an interest in how you make sure the systems that are responsible for delivery can benefit from all sorts of further innovation. This is critical to providing a subsidy to making sure that these opportunities to improve people's health on the front lines actually happens. But as everybody knows, it's not sufficient. And one of the jobs then that the World Bank group has is to really convince governments that, in fact, investments in health for neglected tropical diseases are very important. And that's why we're very pleased to announce today that our negotiations with governments in Africa have led not to $115 million, but $120 million commitment to address the delivery of neglected tropical diseases. These are targeting, Margaret, some of the areas of greatest need, the Senegal River Basin, the Sahelian zone of West Africa. And what we're finding, these are not gifts, meaning this isn't a grant. This is money from our Fund for the Poorest, the International Development Association, but it's a concessional loan, which then will be paid back. And this means that governments with whom we're are investing. They're taking on this responsibility, and we see this as a very important step to further investment. Two further things, though, is that what we're finding as we engage in delivery more fundamentally is that you can do this by structuring incentives into the system so that you're much more likely to achieve and reach your intended beneficiaries. And we call this results-based financing. But we find that, in fact, instead of getting to 40% of the population in a delivery program, we may get to 60 or 70% by structuring incentives into the delivery system so that those people who are on the front lines will be paid for achieving results. And so this is a big change in the way in which the bank is operating, and we're finding that a lot of partners are coming along and joining us in that way of delivery. Second thing is that it's not just the health sector. We have our global partnership for education here, but children with intestinal helminths are school-going, or we hope they're school-going, and therefore bringing interventions into the schools and having school health programs is an incredible opportunity to leverage the delivery capacity of educational institutions, and that's much more cost-effective than it would be trying to bring all those children to health facilities. So I think that those are some of the ways in which the things are moving forward. Let me finish by simply saying one of the things that's so exciting about this and why this is such a great investment is we already have evidence that this works. And I mentioned onchocerciasis earlier. It's the 40th anniversary of the onchocerciasis control program. And if you look where we are today relative to where we are 40 years ago, virtually no one is going blind due to onchocerciasis. That is an incredible achievement. But it was a sustained commitment over 40 years. And I think that's what's so exciting about this. This is not just a short-term mobilization. This is a commitment to really achieve the sorts of things that have already been achieved through the onchocerciasis control program.
Thank you, Tim. That's really impressive. Jamie, Guinea worm is really a fight you have been conducting at CIF and supporting Kenya's national school program. And and 6 million children already treated. And now you are starting a new phase. So what's your new target, your new challenge?
Sure. As we look at an investment, there are principles that make it strategic for us. And to highlight some of those, one is that there has to be the evidence that if we work in an area, we would have a profound impact on a large scale of children. And we have actually the Cabinet Secretary for Health from Kenya here. In that program that we backed, where you mentioned we reached 6 million children, in 1 year, infections went down from 35% of children to 10%, with only 1% having severe infections. This is an area we can make a real difference. We also always ask ourselves, will we be additive? And is this a leveraged investment? And because of the donations of the pharmaceuticals and their generosity, coupled with the fact that we can deworm through the education system, it's 50 cents per child to deworm. It is one of the best investments, and we're not nearly, for anybody looking to join, at capacity of being able to use the drugs that are donated and available. And the third question that we ask is, will our investment be sustainable? And when we began working in this area, we worked off a model that said if we are systematic about deworming, if we do this in a way, in fact, Kenya has exceeded our expectations, that we could bring down the rate of prevalence to a point where it would be very, very manageable for a country to control infections, put out fires. They wouldn't have to deworm on a regular basis. New modeling from Roy Anderson and Simon Brooker now show us that we may have the opportunity to break transmission altogether if we tinker a bit. And Kenya has put up its hand, I'm sure Burundi will as well, to model out those new ways of delivering these drugs with the hope of doing that. And that has launched us, to your question, to join a very exciting new collaboration and to make a much larger and new commitment at SIF and join with others. And I'm going to read the commitment that we are all making so I get everybody's right and don't miss. But it's a new global partnership to fight soil-transmitted helminths with over 120 million new U.S. dollars committed to scale up deworming efforts, catalyze country demand for treatment, and develop new tools and strategies for interrupting transmission. And it builds on this huge existing commitment from GlaxoSmithKline, Johnson & Johnson, and others to supply 600 million doses of deworming drugs each year for all at-risk school-age children. And those joining in this effort, they're in alphabetical order, which puts me first. The Children's Investment Fund is committing 50 million U.S. dollars to work through systematic deworming. Dubai Cares, which will be designing and funding programs that integrate nutrition, wash, and deworming interventions in schools to increase school enrollment and learning outcomes. The Gates Foundation, also committing 50 million new U.S. dollars to explore the feasibility of interrupting transmission and mitigating the risks of drug resistance, as well as the most effective cross-sector approaches. The Global Partnership for Education, assisting the education sectors in developing countries to deliver donated deworming drugs to children. Mundo Sanyo, dedicating 3.7 U.S. dollars to test strategies in partnership with local governments for deworming and combination treatments, particularly in the Americas. Vitamin Angels, committing 4.5 U.S. dollars to scale up deworming, 4.5 million U.S. dollars, working to deliver WASH programs in NTD endemic areas and foster collaboration between WASH stakeholders and agencies working on NTDs, education, nutrition, and health. And last but not least, the World Food Program, which is working to ensure deworming is provided to millions of children as part of its current school feeding programs. In addition, as Tim mentioned, there's the World Bank commitment.
Thank you, Jamie. I think it was this tour de table was very interesting because we see what role everyone is playing, and you make a beautiful synthesis. Once all these efforts can bring down the disease, then the government can manage it. That, I think, was so clear-cut for me. If we can do that really very strongly, then government can take the lead afterwards. I think that fixes the target. We have a capacity of having some questions, even if time is running. And thank you, because you have been very concise and straightforward. And I have a first question, have some written question there. And first I want to tell you that we are not alone. We seem to be in a room but with all of you, but there is more 64 webcast partners, and there is 89 countries looking and participating by the web. At least there is 6 parties, gathered people in 6 countries looking at this panel, listening and participating. So some questions are coming from this very big audience. The first question is, I would like Kofi Nyarko to respond. Kofi is a survivor of leprosy. He's working from Ghana, a very passionate advocate for Ghana. And we talk a lot about the neglected diseases. And there is, of course, some elements that you say in many forms that this issue is about neglected patients. People are not caring for. And, of course, Kofi is doing it, taking care, even if he has suffered this terrible disease. So what's your statement you would like to do? I don't know, where is he?
I'm here.
Oh, thank you. Thank you, Kofi. So,
thank you very much. In somewhere this morning, I was thinking I would not have chance even to ask a single question, but thank you very much for asking me to ask a question. My first question is, would the people affected by, that is, neglected tropical diseases will be involved in the, will be involved as a partnership? I want to know.
Margaret, you want to?
And also the second one, let me add the second one also. Yeah. Okay. People who had Hansen disease or leprosy, what are the London Declaration is doing also for leprosy, those who had leprosy? Thank you.
So one question, how this community will work in partnership with people, which is very important, community, with the patient, the neglected patients, and second, leprosy in particular. So I don't know, Margaret, you want to begin? Or?
Yes, sure. Thank you for that question. Leprosy is still a problem that we need to scale up our efforts. And we still see many cases, too many cases, in India, Indonesia, and Brazil. And, of course, Nepal and other countries. This is an area I am in discussion with. I have an ambassador for leprosy, Mr. Sasakawa, and we really need to review what are some of the things that we can do to scale up action to drive down the cases, because the medicines is here. And I want to thank, the company that make the donation. Medicine, availability of medicine is not an issue, but how do we get it to the people? But let's also be honest. The discrimination, the unfounded, unjustified discrimination is also a barrier to care. And I fully agree with you. How can we engage the affected community to get their input? Because, there is a program we need to rehabilitate some of the people affected who have, disabilities. Now, what was the first question? Now I forgot. Oh, engaging the community. Yes, absolutely. And leprosy. I answer both questions. Thank you.
Chris, please. What would be your answer to both these questions?
I was just going to add on the leprosy. I mean, it is true that the number of cases is stable somewhere around 200 to 250,000 a year, so that says transmission is still an issue. There is some research that has suggested that if you actually treat family members early with preventive care, then that you can reduce transmission by 60%. So It's actually Novartis and Joe Jimenez and his team are actually working with a number of community groups to see how they can actually get more family members treated in a preventive way.
Thank you. I have another question from Dr. Pauline Mwinzi. She is in where is she? Global Health Research, Kenya Medical Research Institute. And she's asking a question. We cannot have her with us, but her written question is, international organizations that have signed up for the London Declaration invested a lot in disease control and elimination in Africa. And the question is, what you will do with the government of Africa? How you can engage them? You have been, of course, responding partially, but you could maybe elaborate a little more. And I know that I have to hurry up. Yeah.
I think this is I think everybody's underlined the importance of government. Because they are the primary steward of the health sector, not surprisingly. And the Honourable Minister in her remarks, I think, made it very clear that we need to think about integrating these strategies related to priority health conditions into the mainstream of policy for health in these countries. We're very interested in making sure that we have universal health coverage, which means that people have access to essential interventions they need that are of sufficient quality, but without financial ruin. And I think that we're in a period where governments increasingly from low, middle-income countries are increasingly undertaking these ambitious reforms. I think NTDs are a litmus test for this. To what extent can we see serious high levels of coverage for these conditions as part of these ambitious reforms? How can we make sure the front lines, those populations that are least likely to get services, are on the top of the priority list with respect to the government? This means looking, for example, very explicitly at the design of benefit packages in terms of insurance to see that, in fact, the front line of the system, the drug procurement systems are actually sensitive and capable of integrating these important delivery systems. It's a long road to go, but it's absolutely one where we need to begin now, because we all know that in the long run that the government will play a very, very important role in sustaining the integrity of these services.
Thank you. And I think it's very important. Marisol Touraine was mentioning that France is engaged through this universal coverage for health to really have sustainable system everywhere. And I think that, of course, a major dimension of all this. I have a question from Julien Potet, who I don't know who is here. He's around. I think Julien will concern about this small businesses' role in all this neglected tropical disease, and that's good. I don't know where is he. Can you? Okay, thank you.
So my name is
That's a
Julien
blindness issue. They will find me a sort of pill for this myopia. Thank you. Go.
Thank you. My name is Julien Potet. I work for Médecins Sans Frontières Access Campaign. And my question is about all these other NTD products that are produced by smaller companies than the multinational companies that are the signatories. For example, pentavalent antimonials for leishmaniasis, for example. So I would like to know what are your thoughts about that, because basically these smaller companies may not be in a position to offer donations because the model of donation does not suit their business imperatives. So what can be done about that? And another maybe side effect of donations as well may be that donations may also kill the incentives for the introduction and the development of new, better products. So I'd like you maybe to reflect about that and propose some new policies in order to address these limitations of current donations.
Thank you, Julien. So the problem is how we have the small business a role for them, what the economic system or business model we have been talking about can really involve them. Of course, again, it's a question between regulation, organization, maybe cooperative. I don't know. Bill, you would like to come on?
Sure. Mm-hmm. No, I think it's the need to retain and the innovation incentive is very, very important. We always have to be incredibly careful about that. And I think what we have here is really quite exceptional. Because it's mostly big companies who are very generous, and because they've done a great job of getting their marginal cost for these down, this is operating on a donation basis. But as the questioner said, if you're a smaller company, you probably can't afford to do that. I mean, it's the profits from the broad product range that the companies have that are allowing them to do this. So in that case, we'd have to activate some combination of development assistance, philanthropic money, and the domestic government money. And over time, the domestic government money should take over that. Over the next 20 years, I think the number of countries who will be able to support themselves, there'll be very few that aren't in that position. When we work, say, on vaccines, the marginal costs are much higher. And that's a system where we're using tiered pricing, and the bottom tier is related to the cost of making the medicine, but you still have lots and lots of markets that are there to create the incentive, to pay back the R&D and create the business opportunity. So judging, exactly how this should work, it's going to vary by product class, and we do want to be careful. Also, sustainability is important, and here we have the companies making long-term commitments.
Chris, do you have? Margaret, you want to?
Thank you for that question, because you raise an important issue. Donations should not stifle innovation, and that is not the case. And you have heard from Bill and others. They are trying to improve existing treatment to make them, less reliant on cold chain and make it easier for delivery, for example, oral medicine. So those are innovation. But innovation in delivery system is extremely important as well. And hitherto, far too many of us make too many mistakes. We look at programs, we deliver them in silos. HIV, TB, malaria, maternal, child health. They're all excellent programs. But you have an additional cost, and actually I call them a waste. So can we rethink the new delivery model to bring things together to get the coherence and the synergy? Now, another point you talk about whether or not, the big companies can do it, the small companies. Well, the economics, as Bill explained it, does not make it conducive for small companies to donate. But you don't have to donate. You can do something else. Think of good ideas. Innovation is the way to go. You, MSF, is one of the leaders in delivery mechanisms. So we can, talk to you and see what are some of the things we can do to really reduce the waste, get, value for money in terms of improving the delivery system.
Tim wants, and then I will give the floor to Chris. It's a big question. How system where the big companies for all these sort of type of profits and managing and solidarity can do, but at the same time it's very important to have local companies living and sustaining in the long run. So 1 minute and 1 minute, Chris, because just I'm
very quickly, and I think the reality is everybody knows that we wouldn't have a pharmaceutical industry if it was by donation for everything, and so markets are critical. The bank has been working in Africa, looking at how we can develop and strengthen the regulatory system for pharmaceutical companies and for the pharmaceutical sector. Which is going to enhance both the quantity and quality of procurement. And if you look at the trends in economic growth over the last decade, Africa has been growing very quickly and is likely to continue to grow very quickly, with many countries graduating from low to middle income country status. And so I think in that context, if we have a stronger national capacity for quality and quantity procurement and distribution of pharmaceuticals, then that market will be very interesting to all companies.
Yeah, just I think obviously we are doing some research even without these, and you've heard some of that. It is true, though, that if you're going to get into novel targets, novel molecules, especially biologics, that we probably do need to think of some mechanism. If you look at what we did with pediatric indications, if you look at what we've done with rare diseases, in sometimes offering extra data exclusivity for companies that do discovery work in some of these areas, I think that would be one sort of an incentive, for example, that could possibly work.
Thank you. Of course, it's a trade-off. I have a very interesting question of the efficiency of the school-based program, but we have to finish. And I would like to all of you to have a sort of a last message. So if somebody of you, with your closing remarks, could address a question of Ellen Hamilton, with saying, how can we ensure that community and school-based mass drug administration reach the most marginalized and vulnerable people? I think it's a major question. So, Onésime, would you like to start your last message? You want to go, how we go forward, and your last message for the future? And then we are making our closing remarks. So, do you want to say something? Juste pour terminer? Okay.
Thank you. Thank you. In the near future, as a country, first of all, we know that necrotropical diseases are concern essentially poor people, and there are many in undeveloped area, underdeveloped area. So first of all, we must work on all health determinants, if I can say. This is on the country level. I think political leaders must work on all health determinants. And as I am a medical doctor, we must do mass drug administration and pay attention so that we reach every endemic population. And as it is proved that by treating we can eliminate necrotropical diseases, you understand that the treatment must be continued. Also, we need surveillance. We need also operational researches. So, I mean, for this question, the help still be needed, but the leadership, the endemic country leadership is necessary also. Thank you.
Thank you, Onésime. Chris, your half a minute statement for the future.
Well, I'll use the half minute to give credit to Bill Gates, because I think Bill is an independent party. He's respected by everybody because of not only the significant financial resources he brings to bear, but his own personal resources. We live in a very complicated world of healthcare. Bill knows all of the subjects in the greatest of detail, works tirelessly on that. For us as an industry, we have found that working with the Bill and Melinda Gates Foundation provides a different way of working with others, because what we've seen is you cannot just solve these problems with medicines alone. We're going to have to work in partnership. But by having Bill in there, he has been able to bring together not only the industry, but different stakeholders in a sense where everybody's a lot more comfortable working between public and private sectors and NGOs. And so, quite honestly, I think, as I look at the last 25 years, the most transformative thing that's happened in how we can deal with people who don't have access to health care is really the influence that Bill personally has brought to it. So I'd like to thank Bill very much.
Margaret, you'll have
I tell you, he stole my line. So, okay, I'll use my half minute to say that I always believe in country ownership, political commitment, partners, including Bréchot, foundations, civil society, industry, are catalysts. We're here to support your efforts. Political commitment, country ownership, partnership, innovation, and capacity in the countries so that they can take over eventually.
Thank you.
Yeah, I think what we're seeing today is the value of partnership, people working together. And I think what drives us forward is a combination of sort of heart plus head. In terms of caring about these issues, and unfortunately everybody here does care about these issues. We were nice to ourselves today. We didn't actually show, what it's like to suffer from these diseases. But if anybody's ever forgetting, how important this is, visiting Africa is the best. But if not, you can go to the web and look up these 10 diseases and remind yourself, how you would feel to have yourself or your children subject to these diseases. Heart alone's not enough. We've got to have the report cards on delivery, report cards on the countries, report cards on disease burden. And I think we're off to a great start having the report cards that are going to keep us all engaged in the best way.
Thank you. Thank you. Jamie.
Sure. Secretary Macharia will do a much better job tomorrow talking about how to reach the most neglected, but it is because of the leadership of the Kenyan ministry that they did indeed so well surpass. First of all, going through the schools is the way to reach the most children, and that's why I think the Ministry of Health has been so eager to partner on this. But it is, the goal was something like 5 million children. They reached 6 million because of the health ministry's real efforts to bring out children who weren't part of the system. And it's a great accomplishment. And I think on this case, we really did reach most of the most excluded. In terms of final thoughts is, when we first looked at deworming and started as a philanthropy, it was a nice thing to do for children. Because of the partnerships, because of the generosity, because of governments taking real leadership, and because of this modeling, we have potential to have a phenomenal, profound impact. And I really do hope we'll all rally and make it happen.
Thank you, Jeremy. Tim.
Thanks. I think the World Bank Group shares the excitement, and we're privileged and honored to be part of this partnership. It really represents a manifestation of our broader mission to eliminate extreme poverty and boost shared prosperity. But more fundamentally, it's really that expression of valuing everybody's lives equally. And I think that's what draws this group together, and I think that's an incredibly important civilizing force in the 21st century. So to be part of this is a great opportunity, but I think what I also think is characteristic of this initiative is its commitment to learning and learning to do better. And I think if we can systematically think about that from the bench to the bush, from the laboratory to the front lines, then we're not only going to achieve what we seek to achieve through this partnership, but it's going to strengthen our abilities to have much better performing health systems, beyond this problem. So I think very, very important opportunity. We're delighted to be part of it.
Thank you, Tim. I'm sorry because I skipped many interesting questions for the audience. I will skip my concluding remarks as well. I just want to close saying, as a French diplomat, I was always asked, why do France put so much money? We don't have that big ODA, by the way. It's a pity, even if it's not negligible. But why do you put so much money on health? And that's why. It's a very important sector. There is really a great innovation going on. With NGO, with companies, with UN organization, with World Bank. It's a sort of philanthropy. It's a sort of role model for international cooperation. So I said always, that's worth doing it, and I'm feeling it even more listening to you. Thank you, and a round of applause for all of them.